Alright, here's the thing. Mental illness is anticipated to be the second most serious health concern afflicting Malaysians after heart disease, and according to the most recent National Health and Morbidity Survey, one in every three Malaysian adults aged 16 and above suffers from mental health problems. Unfortunately, there is still a dearth of information on the condition, particularly in terms of prevalent mental disorders, causes, potential consequences, and recognizing the early indicators of significant mental problems. From a cultural standpoint, molded by superstitious beliefs and misinformation, there is also a substantial social stigma connected with mental illness. And because of this negative perception, patients with mental illness frequently suffers in silence, often ostracized by society with a little prospect of acceptance, let alone recovery. Dr. Michael Ang Jin Kiat, a psychiatrist and senior lecturer at University Putra Malaysia, stated that the condition can manifest itself in a variety of ways, with the most severe and common mental illnesses being schizophrenia, major depressive disorder, and bipolar disorder. Dr. Michael also stated in his lecture on the topic of understanding mental illness that approximately 40% with schizophrenia attempted suicide globally, and with 10 of them dying by suicide. Mental illness is a rising issue in this country, as it is in many parts of the world, and it should be handled seriously. However, due to insufficient number of psychiatrists in Malaysia, there is not much avenue for those with mental issues. The number of psychiatrists in Malaysia until December 2021 was only 459, namely from Ministry of Health, public universities, private universities, armed forces, and private sector. Based on the Health Ministry's most recent publicly accessible data, Malay Mail calculated that the country would require an additional 493 psychiatrists by the year 2030 to meet the country's anticipated population. According to Health Minister Khairi Jamaluddin, these aims are based on the ratio of the size of the population that doctors should ideally serve. The Health Minister stated that it was constantly trying to enhance the number of psychiatrists in Malaysia in order to meet the target figures, including by reappointing retired Malaysian psychiatrists on a contract basis to service with the ministry on a needs basis. As part of its attempts to enhance the number of psychiatrists in Malaysia, Minister of Health also announced that medical officer can also pursue the parallel pathway for training to be specialists, utilizing foreign qualifications such as the member of the Royal College of Psychiatrists. However, thanks to the non-governmental health organization and volunteer support group, there is now a larger awareness on this issue, and the stigma of seeking treatment is gradually fading. This is evidenced by an upsurge in calls to volunteer support group Befrienders Johor Bahru. And according to its president Danny Lu, Befrienders Johor Bahru received about 1,837 calls in the first 6 months of the year, even though the center had to close twice due to the COVID-19 outbreak. Befrienders Johor Bahru, in addition to responding to such calls, is actively disseminating mental health awareness among the general public. And according to the group's publicity director, Justin To, at least one online discussion is held every month, conducted by mental health professionals who strive to increase awareness on various themes. Nonetheless, the knowledge of mental health concerns remains poor, and treatment is frequently delayed as a result of the stigma attached to Malaysian society. But the effort to spread awareness is surely increasing. That's all from me. Thank you.